welcome to the Ignorance Project. Today, I'm very excited about having a guest, Dr. Janelle Howell. Janelle, you want to go ahead and introduce yourself to the audience?
Sure, Shireen. I am so excited to talk with you. My name is Janelle, as you mentioned. I am a doctor of physical therapy, but I specialize in teaching women and people who struggle with chronic sexual pain and shame how to overcome that so that they can experience pain-free sex and pleasure in life and love. So that's the main thing that I focus on, but I also just love educating people via social media and providing a platform for people to talk about taboo topics like sex and periods and stuff without the secrecy and the shame and all of that. So that's who I am, and I'm glad to be here.
Thank you. And before we get into our topic for the day, I just want to say what you do, I think it's so amazing in a needed space, especially there's so many of us that grew up in the church and this was an uncomfortable topic. Sex is always an uncomfortable topic, I feel like, in the spaces that we grew up in. So
Yeah,
before we kick off, I do have a question for you, which is like, how did you get into this?
that's a good question. So I actually didn't immediately go right into pelvic floor physical therapy. When I was in physical therapy school, I was introduced to a very short and like just not enough regarding the pelvic floor muscles, which
Right.
are the muscles that keep us from peeing on ourselves, the muscles that open up to allow us to have a bowel movement, all of those intimate muscles down there. And
Mhm.
so I heard about it. We had a very short class, and I just remember thinking, like, oh, this is interesting.
Mhm.
I think I would like doing this because it's different. And that was
Yeah.
really the main thing about it.
Oh, okay.
But then after I graduated school, I had to just start working to start paying off my student loans. So
Mhm.
I actually started in the typical like orthopedic setting of,
Mhm.
oh, my back hurts, my shoulder is sprained, my ankle,
Yeah.
that type of stuff.
Yeah.
And then after doing traveling therapy for a while, traveling physical therapy,
Mhm.
I got placed in a position for pelvic health and physical therapy.
Mm.
And
Okay.
that's where I really just fell in love with it almost
Right.
immediately.
Right.
I started off doing more of the like bladder control stuff, like I
Mhm.
pee when I sneeze or I
Mm.
can't make it to the bathroom. But then with time, I realized that I enjoyed helping people more with like overcoming sexual pain and helping them with pleasure and stuff.
Mhm.
So that's more of what I focus on now.
It's so cool too because I didn't really know this was a thing until I started seeing you post about it. I had no clue that
Yeah.
this
Most
was a
people don't.
specialty. Yeah.
Yeah. Yeah,
So
even
this
like doctors. I mean, there are
really,
professional people out there who have never
right.
heard of number one, the pelvic floor. Like, what is
Yeah.
that? And then
Right.
number two, like pelvic floor physical therapist. So there's a lot of work to be done. And I
Mhm.
appreciate you bringing me on the podcast because just getting the word out is such a
Mhm.
huge step.
I agree. So thank you. You're doing God's work.
Oh, thanks, girl.
It's true. It's true. So I reached out to you about having this conversation after I saw you post about Jessica Pettway, who was an influencer that unfortunately passed because she was misdiagnosed with fibroids when in reality she had cervical cancer.
Hmm.
And of course, you did a very informative post talking about how Black women we die at a higher rate from cervical cancer than white women do.
Yeah.
Before I get into that, I just want to talk about the response that you received for
Hmm.
making that post
Hmm.
and really people kind of being upset that you called out Black women specifically,
Yeah.
right?
Yeah. So the situation is unfortunate.
Mm-hmm.
Um, but her situation is actually very common.
Mm-hmm.
This Black female YouTuber who stepped on like the scene of like beauty
Right.
influencing and hair very early. I think she had a pretty large YouTube
Mm-hmm.
following. And she passed away because she had cervical cancer,
Right.
but she was told for several months, close to a year, that it was fibroids.
You're right.
And so the treatment process for fibroids is a lot different than cervical cancer,
Mm-hmm.
obviously, right?
Mm-hmm.
If you know that you have cervical cancer, especially if it's stage 2 or 3, there's going to be more invasive, urgent things
Right.
being done to remove that cancer, or at least try.
Mm-hmm.
And so she was told to go home after a few days of like going there for essentially just management and
Right.
then being released home after getting like blood transfusions.
Mm-hmm.
Because what was concerning for me is that she was passing so much blood and she was passing so many blood clots that she needed 10 blood transfusions
Wow.
in one sitting. To me, that is like an obvious sign, especially as a clinician, that
Right.
you need to dig further and figure out what's going on.
Right.
Why didn't no one actually try and look at her cervix
And go
first?
deeper.
Yeah,
Mm-hmm. Mm-hmm. I
yeah. To
know,
me, it's crazy.
exactly. I know I suffer from endometriosis, and it
Oh,
took me years to really get one diagnosed, years of going to the hospital with just this intense, excruciating pain and heavy bleeding and feeling like something's got to be wrong and being put on birth control because it's a band-aid, right? And that's something else I've seen you talk about where a lot of times we get put on birth control, but it's not addressing the root of what the issue is.
mhm.
So I have started to be more of an advocate for myself, which is also annoying because she did the right thing. She went to the doctor. She said, "Hey, I'm having this issue." She got diagnosed and she's thinking like, "Yeah, this is it. I'm taking the steps."
Right.
So, where as you as a clinician, where would you say we as women need to push back a little bit more if we feel like the issue that we're having isn't properly being addressed?
Well, it's going to be impossible to know if the issue is not being properly addressed if you're not
Mm,
educated.
mm,
So I think number one, yes, it would be great to have better doctors and better clinicians and better
right.
researchers. But that's almost like a political thing. There needs to be more
Mm,
funding for
mhm,
better education, starting as early as medical school. So I think that's more of a higher level problem. And if someone's listening and they're like a politician or something, then great, we need you. But I think in terms of what we can do is start truly investing in educational
mm,
sources for our bodies.
mhm,
Because if you don't know what's an abnormal size for a blood clot,
mhm.
then if that's been happening to you your whole life or worse, you have other women in your family that are like, yeah, girl, that happens to me too. But the blood clot is
Yeah,
as
yeah,
big as a strawberry
you're
or
right.
whatever it is. You're not going to know what to do, especially if you've been having this problem before, or you
Mhm,
have other women in your family that are also struggling
mhm.
just like you. So
Yeah.
we're normalizing dysfunction because we're not educated on what's
Mhm,
right and what's abnormal.
mhm.
So I think the same way that, when we get paid and we go shopping and that's normal,
Right.
then we should normalize, like spend money on education. Like, what can you read? What class can you take? What podcast can you listen to?
Mhm.
Because it's literally taking us out.
Right.
We're dying at record high rates, and most of the time it's preventable.
Exactly. Yeah. So you, of course, are a Black doctor. I know personally, I try to find a Black doctor when I'm looking for someone to treat me. Do you find a lot of your patients that have like found you and just felt like finally there's someone that looks like me that can address the issues that I'm having?
Mm, I would say not necessarily
Okay.
because I have so many different services. So
Mm,
I have master classes and stretch
right.
labs, which are essentially like exercise classes led by myself, where I teach
Mm,
people about their pelvic floor, how to relax those muscles if they have painful periods, painful sex,
right.
foot pain, any of that stuff. And then I also have things like master classes. So
Mhm,
that's going to be more in depth. Like, what are the causes of your pain? What
mm,
are the contributing factors? And then what are some higher level things you can do besides just stretching at home to help? And
mhm.
so I do that quite a bit. But then I also have more like one on one luxury services. And so I do get some women of color.
Mhm.
I would say not so much because it's more of a higher ticket option. And so what I do instead to still support women of color practitioners is I have a directory
Okay.
on my website where we can go if you want to be treated specifically
Hmm.
by a woman of color pelvic floor therapist. So
Okay.
it's hundreds of us on there, and it's international. So we have therapists in Jamaica, in Canada,
Mm.
Nigeria, and
That's
Kenya.
wow.
Yeah, so it's
Wow.
amazing. I'm glad that I was able to start that.
Hmm.
But I guess also yes, but just not super often. When I
Hmm.
work with Black people, they
Hmm.
are like, it's refreshing to like have a clinician and a doctor who
Right.
is Black, like your
Right.
sister. Like it's a good feeling, but it's
Right.
not like every day they're saying that. And I think
Hmm.
that's because my one-on-one services are a little bit more luxury. And so
You're right, right, right. That
it's
makes
a
sense.
bit of everyone coming in there, but not just like Black people, obviously. Uh,
Okay.
so
So you
yeah.
mentioned your directory, and one of the questions I was going to ask is what would you recommend women look up when they're looking for services like yours? So how would someone access that directory?
They can go to my website,
Okay.
vaginarehabdoctor.com,
Okay.
and essentially it's a lot of therapists on there. So
Mm-hmm.
therapists that focus on postpartum health,
Mm-hmm.
pelvic floor therapists that focus on incontinence, pelvic floor therapists like myself that focus on sexual pain.
Mm-hmm.
I specifically like focusing on vaginismus. And
Oh,
that's where penetration can't happen at all because the
right.
muscles are tight, or it's so painful just trying to get in with
Mm-hmm.
intercourse that essentially they give up, or it's a nightmare.
And I
Um,
love reading your stories too, because I had no clue so many women experience this and kind of seeing you talk about women that have had it and they've been married for like 6 years, 10 years, and you're
yeah,
able to help them. That's such a blessing on, your part that you're able to do that.
me too. I'm like, listen, I want you to go get some. Like, I'm like, listen, you've been married too long and you ain't gotten the
Girl,
deep end of
yeah.
me. Like,
Yeah.
we gotta help you. So,
Because I had no clue that, like I said, I didn't know that was a thing until I saw you talk about it. I'm like, wow.
girl, and listen, Shireen, they
Yeah.
say research shows that 1 in 4 Christian women have it. 1 in 4
Wow. What?
cannot, like, and it's not just sex because
Right.
so one of the misunderstandings, and I'm actually like trying to do better as a clinician
Hmm.
because the way I typically describe the problem is as a sex problem. But
Mm.
vaginismus doesn't just make penetration impossible or
Hmm.
severely painful,
Hmm.
but like just getting in a tampon can be impossible.
Wow.
So you have women and people who grew up like just not ever being able to put in a tampon
Right.
are like, you know what? Tampons are not for me. I'm just going to use a pad.
Yeah.
Meanwhile, listen, you got a whole medical condition that you need to work that thing out as soon as possible.
Wow. You're right.
Yeah, and it's also like going to see your doctor. So
Hmm.
a lot of people are avoiding the gynecologist, like they haven't seen one in years, and that's not healthy. Like we need to get
Hmm.
pelvic exams. We're literally here because of the situation that happened with Jessica Pettway.
Hmm.
So if you can't even get a pelvic exam, how do you even check on your cervix? So
Hmm.
that is also a big part of it. So I specialize in vaginismus, and so a lot of people that come to me, and also my
Right.
so Dr. Mappa, she works with me, and we
Right.
do the coaching together.
Hmm.
And many of the people that come have even already gone to a pelvic floor physical therapist.
Right.
So I love setting myself apart in that I feel we are more like specialists
Hmm.
opposed to a pelvic floor therapist trying to treat everything under the sun.
Hmm.
So the sex hurt,
Focus on that.
okay, come
Yeah.
to us, you
Come to
know?
us if that happens.
Yeah,
So I want to go back for a second because you mentioned so if someone goes to the gyno and they're not able to get a pelvic, that's an issue that should be addressed.
definitely. And
Wow.
there's so many things happening there. So number one, there's the avoidance.
Right.
And there's a lot of things that we could bring up. Like
Hmm.
we have to hold space for people who have experienced trauma. Right.
Mm.
So someone is less likely to go get a pelvic exam if they've experienced sexual trauma.
Hmm.
Same thing with medical trauma. You had a doctor who just tried to shove it up there, and you have a whole
Mm.
memory attached with a pelvic exam.
Right.
So that can make it more difficult. And I always encourage people to see a therapist if they have
Hmm.
access to get counseling.
Hmm.
Um, but I mean, just they're doing so many things. Like people have to go under anesthesia to get a pelvic exam.
Oh my goodness.
Yeah, people have to use a child-sized speculum just to,
Right.
and it still could be painful even with that. or they're just avoiding it altogether. I mean, so it's actually really common in a lot of women and people, um, anyone with a vagina, regardless of how they identify.
Hmm.
It's so common, but no one is talking about it.
Yeah.
So it's like, and a lot of people don't even know it's a problem. It's
Mm-mm.
like so many issues, girl. It's like
I
where
know.
yeah,
I know I've had people say that they've had trouble with that, but I never thought about it being an issue. I thought it was just like, well, and
yeah,
especially with their doctors. And I think that going back to the original point, like your doctors aren't always going to advocate for you the way that you have to advocate for yourself.
right,
So
right.
again, that's why discussions like this are so important. Um,
Absolutely. And it's
yeah.
tiring because it seems like a lot of the solutions are on the victim. Like, okay, I'm
Hmm.
experiencing the problem, but now I got to advocate harder. I got to preach harder. I got to yell louder.
Yeah.
But unfortunately, because of the world that we live in, you do. And
Right, right.
sometimes it's also just asking more specific questions. And that's
Hmm.
why I say education is such a big piece because most people don't even know they can just ask like, hey, can I check my vitamin D levels? Like
Mm.
simple questions like that
Hmm.
need to be asked. And your
Right.
doctor should say yes if
Hmm.
it's within their scope of practice. And so conversations like this are just something that needs to continue happening so we
Absolutely.
can normalize the priority of our health and being listened to in healthcare.
Do you notice a difference with how your patients of color respond to their treatment? Meaning, um, I know that there's a lot of, again, stigma in our community about going to the doctor. So
Mhm.
we're already resistant to being there. Do you
Right.
see that they do less of the homework you assign? And by homework, I mean like, okay, do these 10 exercises before we meet again, eat this way, or, whatever you assign for them to do for their treatment.
Um, I would say one of the biggest things that I see differing
Mhm.
between people of color and non, well, I don't want to call them non, but people of color and white people.
Yeah.
What are we
Yeah.
calling everyone else?
Right.
So the biggest thing that I see is actually language.
Oh,
So
okay.
when Black women specifically, and also women of color, talk about pain and painful sex,
Hmm.
they typically say like it's uncomfortable. And
Hmm.
I'm like, sis, does it hurt? And they're like, yes, it does. And I'm just like,
Oh my
that's called
goodness.
pain. Like,
Right.
so it's almost as if we don't want to actually say this hurts or I'm in pain.
Hmm.
It's common for us to say this is uncomfortable, it aches, it doesn't feel good, but it's almost as if like we are not used to actually admitting that
Right.
we are in pain. And I
Right.
don't know where that comes from. I mean, I know it has to do something with race and culture,
Hmm.
but I would love for that not to be a thing
I know. I
because
always feel like it's a sign of weakness when they're like, how are you feeling on a scale of 1 to 10? I'm always like, okay, what's the least amount that I can say? I don't know why I do that, but I notice I do that myself where I'm like, I don't want to sound weak. I don't want to sound like
right,
I can't take
right.
it, but that's ridiculous.
And even women that are Black women specifically and
Right.
that are having sex, if your partner asks you if it hurts, a lot of times the response would be, what?
Mm.
If you're gonna do all of that, there's some pain involved.
That's the problem.
There's some pain involved. Like, and so I don't know. And then the other thing is, I think people think that if they're experiencing a little bit of pleasure and some pain at
Mhm.
the same time,
Mhm.
that negates the pain. It doesn't.
Mhm.
Just
Mm-mm.
because you're having some pain doesn't mean that you're not enjoying the experience.
Right.
So you could be having some discomfort or some pain with a particular position or something.
Mhm. Mhm.
And that doesn't mean that you want to just give up on sex altogether.
Mhm.
But people should honestly just get comfortable just saying, like, this hurts, I'm uncomfortable, even
Mhm.
outside of sexuality, just in life,
Mhm.
in relationships and conversations.
Yeah.
And I think that's a big part of advocating for yourself, even outside of healthcare.
Mhm.
Because if you don't know how to talk up for yourself at home,
Mhm.
how are you going to do it in a doctor's
You
office?
can't do it. Yeah.
Yeah.
Right. So I noticed some of the symptoms of cervical cancer are kind of comparable to what I would think someone would go to a pelvic physical therapist for. For example, like maybe pelvic pain, back pain, etc. So
Mhm.
if you were treating someone that came to you with these symptoms, at what point would you think like, okay, maybe there's something more and you need to go get a pap smear, you need to go kind of to another specialist to figure out what's the root of the issue?
So I love that you already mentioned this pap smear. That should be the number one thing.
Hmm.
So pelvic exams, pap smears, that's what actually checks for abnormals in abnormal. Girl, I can't even talk today. Abnormalities in the cervix.
Right.
So there is literally nothing else that
Hmm.
can actually guarantee that there is no abnormalities
Hmm.
in the cervix that may or may not become cervical cancer.
Okay.
That's the importance of getting those pelvic exams, getting
Right.
pap smears. If you're listening and you haven't gotten one, call
Mm.
your doctor, baby. Call them.
Right.
Um, Outside of that, though, I would say when if they're let's say they're coming in for sexual pain or they're coming in for incontinence or
Mm.
even they're having really bad period pain. If things are not getting better with treatment to the pelvic floor, like maybe the pelvic floor is now looking normal. There's no pain in
Hmm.
the actual muscles down there. There's
Hmm.
no tightness. The muscles are strong and able to relax. Then it's like, okay, why are their symptoms not getting better with typical
Right.
prolonged bleeding, severe period pain, clotting? Those are
Hmm.
always going to be signs that you need to check on your pelvis
Hmm.
every time. You shouldn't be bleeding for longer than 7 days.
Hmm.
Your periods, if they are painful, I know this is super common for periods to be super painful.
Right.
Um, if they are painful, taking over the counter medication should actually take care of the pain.
Okay.
If it's not fixing the problem, like if you're not able to still go about your day and go to work or go to
Hmm.
school,
Hmm.
there's still pain after taking a pain pill over the counter, then that's a sign you need to look further. Ask your
Okay.
doctor. Can I
Okay.
check for ovarian cysts? Can I check for fibroids? Can I check
Hmm.
for endometriosis? What can I do to figure out why this is happening?
Hmm.
And it doesn't mean that sometimes it's not simply your lifestyle, because let's be honest, sometimes we're eating horribly, we're sleeping horribly, our stress levels are out, crazy. That can
Hmm.
also cause a lot of pelvic issues.
Okay.
So
So, and what pelvic floor dysfunction, let me rephrase that. What pelvic floor dysfunctions should people be looking to seek help for?
all of them.
Uh,
Okay, so let's talk about the primary ones.
okay.
Primary ones, number one is going to be incontinence.
Hmm.
And this could be of poop or pee.
Mm.
Anytime pee is coming out when you don't want it to, that's incontinence.
That's yeah.
Yeah, so if you sneeze, cough, laugh, jump, run, there should be
Hmm.
no pee coming out. I don't care if you've had a
Hmm.
baby, I don't care if you're 60 or 70, you
Mm.
should be able to control the bladder. If
Okay.
it's coming out involuntarily, that's
Mm.
called urinary incontinence.
Okay.
There's also difficulty with making it to the bathroom. So
Mm.
there's no sneeze, there's no cough, but you just trying to pee on you try not to pee on yourself before you get to the toilet. Like you put
Right.
the key in the door and you're trying to get home, you're trying to get in the house
Yeah.
and
Yeah.
so that's called urinary urgency.
Okay.
That can be pelvic floor dysfunction as well. Anything dealing with bladder pain,
Hmm.
frequent urination is also a big one, especially with our generation that tends to have a lot
Mm.
of anxiety. We're always
Mm.
on the phones. We're always
Right.
connected to tech. We are
Right.
under socialized. With all this social media, we actually have poor social lives.
I
Um,
could see that for sure. Definitely.
yeah, like listen, go actually meet someone in person. And so that anxiety can contribute to the frequent urination of like
Mm.
peeing every 30 minutes, peeing every hour, even
Mm.
is frequency.
Okay.
So all of that we can
Mm.
help with as pelvic
Hmm.
physical therapists. That one is, I would say that's the easiest thing to fix.
Okay.
I love treating bladder stuff because it
Yeah.
usually responds quick, which is
Okay.
exciting. Next would be anything with a vagina. So
Mm.
any pain with pelvic exams, tampons,
Mm.
menstrual cups, obviously penetrative sex, pain with orgasms is really common.
Mm.
Um, well, I don't know if I would say really common, but it happens and
But
it's
it
not.
happens.
Yeah.
Interesting. Okay.
Also pain after sex. And also, let's talk about this one.
Yeah.
Not orgasming.
Okay.
That can be the pelvic
I
floor.
And I wouldn't even think that would need a pelvic floor therapy. Wow. Okay.
Yes, because when you're having an orgasm,
Yeah.
you said this is a video podcast,
Yeah,
right?
it is.
So this is the pelvic floor here,
Okay.
like a bowl. And that's the deepest layer of the pelvic floor. There's
Right.
also a superficial layer. So these are the muscles. If we get rid of the skin, you would see
Mm.
this.
Okay.
And the fat, obviously. And then you would come to the muscles. So
Right.
these muscles actually surround the vagina and also surround the anus.
Mm-hmm.
So when you're having an orgasm is literally your pelvic floor muscles contracting and
Contracting.
relaxing quickly, like
Okay.
this.
Right.
It should be involuntary. So if
Mm-hmm.
you want to hear us listen, you have to squeeze super, super, super tight to reach
Yeah.
the orgasm.
That's the problem.
Uh-oh. Right. And so that could be pelvic floor dysfunction. So
Wow.
if these muscles are too contracted, meaning they're way too
Mm-hmm.
tight, it's
Mm-hmm.
going to be difficult for them to contract and relax because they're
Mm-hmm.
already contracted.
Mm-hmm.
So helping them to release these muscles and relax them can actually help the muscles contract and relax so they can get to an orgasm.
Mm-hmm.
Or if the muscles are really weak, like they're not able to contract because of laxity or they had a baby and the baby was heavy and
Right.
just different things can contribute to too much relaxation in the vagina. And then that can make it difficult to orgasm as well.
Mm-hmm.
And then lastly, poop problems. So constipation, painful
Mm-hmm.
movements,
Mm-hmm.
feeling like you can't get all your poop out.
Right.
That could be just lack of fiber or lack of
Wow.
hydration. Many times it's also the pelvic floor.
Yeah, this is all so
Yeah,
fascinating. Thank
yeah,
you.
yeah,
Thank you.
totally.
Yeah, so I've got one question to close us out. One more question.
Sure.
What is a question that you would say every woman should be asking their medical provider?
I would say you should be asking your provider literally anything that concerns you about your pelvis.
Mm,
I mean, I think we think certain things are off topic, like it's not within bounds.
mm-hmm,
But if you can't ask your medical provider,
mm-hmm.
who can you go
Who
to?
can you go to? Right.
You can't go to your mom, right?
Right.
Probably,
Right.
right? Your friends that can provide social support, but they're probably not medical professionals.
And they're probably going to give you anecdotal advice like, well, I heard this
Yes.
happened.
Yeah, they're
Yeah.
gonna give you something that happened to themselves or happened to
Yeah.
someone they know, but it's not driven by science or research or
Mm-hmm.
anything.
Mm-hmm.
So, like anything dealing with your clitoris, you should bring that up. Anything
Right.
dealing with period pain, you should bring that
Mm-hmm.
up.
Mm-hmm.
And I say all this to say they might not always have the answers,
Mm-hmm.
but I do think you should at least exhaust that option.
Mm-hmm.
Like go to your doctor. Um,
Mm-hmm.
and if you have to change doctors, as uncomfortable and as tedious as that can be,
Right.
if you're not liking your provider, don't keep giving them business.
No. Phew.
Don't
Okay.
drive their business into success by
Right.
continuing to go to them.
Right.
Take the time necessary to actually research. Word of mouth is the best marketing. So if you have friends that love their doctor, then, ask about trying to get on with them. So it's hard to think about just one question.
Right.
I would say literally anything.
That's a
Don't leave those health benefits on the table. Cash in those benefits.
mm-hmm.
That's everything you need to know because it's
Mm-hmm.
body. This is
It's
life.
your health. Yeah.
Yeah. Yeah.
Wow. Thank you so much. I've got a quick round of unrelated to anything questions to ask you. So just say the first thing that pops into your mind.
Okay.
Okay. What's a book everyone should read?
The 4 Hour Work Week.
Hmm.
I read that book several years ago,
Yeah.
and while I didn't immediately obviously start having 4 hour work weeks, it opened me up to possibilities.
Mm-hmm.
And I just had a different I had a different ideal for my work life. Even when I
Right.
was working for someone else,
Right.
I knew I didn't even want to work 5 days a week. I started asking for 4 day a week schedules.
Mm-hmm.
And then when I did quit my job, I started working 3 days a week. Then it went down to 2 days a week. Now I don't
Okay,
even
role
work
model.
everything. I don't have a particular day I have to work at all.
Right.
Yeah. So I think honestly, I think everyone should read that if they're even looking to do anything creative,
Yeah. Yeah.
whether it's a side hustle or going full on entrepreneurship.
Mm-hmm.
I would highly encourage that book.
Wow. Thank you. I'm gonna check that out. What's
Yeah.
a movie everybody should watch?
I don't want to be basic, but uh
It
So
doesn't matter.
I love romantic comedies.
Yeah.
I'm like just basic in that way. One of my favorite ones is Hitch.
Oh,
The
okay.
Will Smith.
Yeah. It's
Yeah, I just
fun.
think that one is so cute.
It is. It is.
The way I found my fiance was actually through a dating app.
Okay.
And before I got back on the dating app, because y'all
Mm,
dating online can suck.
mm,
Like it can be
girl.
the ghetto. Okay? It can be bad. However, so I got off the dating app for probably at least a year, and I
Mhm.
was just watching a romantic comedy. It was so cute. I was like, I want that. I want that. Let me go back on the dating app,
Oh,
and I found my fiance.
I
So
love that. Okay.
yeah.
And last one is a song everyone should listen to.
Oh, girl, I'm bad with this.
Or your favorite song.
Ugh. Um, Shireen, help me out. Beyonce just came out with some stuff.
I'm gonna say something biased. You want to do gospel? You want to do R&B, or
Let's do an R&B. Let's do R&B.
R&B? Let's see. What's the song that you listen to when you like need a pick me up?
Shireen, I need you to help me with music. I don't have that many. I listen to lo-fi lately.
Okay. Okay. That's an
Lo-fi is like
answer.
no lyrics.
That's fine. That's still an answer.
Okay, wait, let me find the name of the song that I really like.
I was about to say, you guys spell that for me.
It's lo-fi, Lofi, and
Okay.
the name of this song that I really like is called Quiet by Jisatsu. You want me to spell
Okay.
that? It's Jisatsu. It's
All
really
right.
calming, relaxing, get your nervous system together.
I love that then. That's an answer. That's your
Okay,
answer.
good.
That's an
Because
answer.
I
Yeah.
feel so bad. I'm like, girl, I'm a black woman and I don't listen to all that much music all the time.
No, that's great. Okay, well, Dr. Howell, thank you so much. I am so just incredibly proud of you. I find you so inspiring, and I just think you're doing an amazing job with educating the masses. You guys go follow Dr. Howell on Instagram. You have a class coming up, right? Which may have already passed by the time we do this, but what's
Yeah.
the class?
Yeah. So the name of the class is actually called The Best Head Ever.
Oh,
And it's
okay.
not about oral sex.
Oh,
People
okay.
probably do that. That was on purpose. So I did that on purpose.
You're right.
But it's actually about focusing on the muscles in your head. A lot
Hmm.
of women have frequent headaches. They have jaw pain, jaw clenching, and they may even have neck pain. And a lot of people don't realize that that's contributing to pelvic floor tension and
Girl, that
pelvic
sounds like
pain.
me.
Yeah,
What?
you need to be in my next master
I
class.
need to let me
So
go look that up.
I'm gonna
Wow.
actually teach everyone who signs up how
Right.
to assess their jaw, like for range of
Mm,
motion, assess
mm,
the muscles. These muscles are really important. It's the muscles we eat and talk with. And
hmm.
if you're in a sexual relationship, I don't know how you're using your mouth. So it may
Yeah.
be even more important for you.
I know I
So
have TMJ. I'm gonna check this out. Thank you.
yeah, yeah.
Yeah,
So
huh.
a lot of women that have the TMJ issue have a
Mm,
lot of tightness in the pelvic floor and they have
mm.
pain down there.
Look at you putting
So
my business on the podcast. No, I'm joking.
no, so listen, this is what I do with my
Yeah.
clients. I actually have them make noise and sound when
Right.
they're trying to release pelvic pain and
Right.
tightness. And the tension goes way quicker if they're just quiet and silent.
Hmm.
So that's what I'll be teaching in my class, how to
Okay.
assess the jaw and then
Okay.
how to use your voice to release pain and tension and also increase
Hmm.
pleasure. So that's called the best head ever. And if people want to work with us one-on-one,
Hmm.
we do offer one-on-one remote coaching
Right.
for sexual pain, pelvic floor tightness,
Hmm.
things like vulvodynia, which is a form of sexual pain as well, and
Hmm.
pelvic floor issues. So definitely reach out to me if you go to the
Yeah.
link in my bio on Instagram
Right.
and get they can learn more about how to work with us.
About your class, one-on-one coaching and all. Okay. Well,
Yep.
thank you so much. Have an amazing weekend. And thank you for listening and watching the Ignorance Project. I hope you leave enlightened.